Mr. President, thank you for allowing me to speak today. Um, there have been several other speakers that have said many negatives and positives about the current healthcare reform bill. I have found several things that could help to decrease the overall cost and to go ahead and help with the federal deficit. Kent Conrad stated an important fact that 5% of Medicare beneficiaries make up half of all expenses due to chronic illnesses, and the annual mean expenditure for them is 40,876. I also learned that the top 1% of patients ranked by their health care expenses accounted for 21% of total health expenditures, with an annual mean of 87,570. An important way to save money here would be through preventive care. Preventive care would help to reduce cost at end of life. Um, the amount of money that we'd have to spend wouldn't be as tragic and as high if we were taking care of patients throughout their lifespan. Another interesting fact that I learned is according to the CBO, more expensive care does not mean higher quality of care, suggesting an opportunity here to go ahead and reduce healthcare costs. There's a wide array of geographical differences in spending on healthcare. Medicare's cost per enrollee varies significantly per region, from as low as $4,000 to as high as $11,000, and this was in 2003. Research has shown that variation in spending cannot be explained by differences in population or medical prices. Higher spending regions do not generate better health outcomes than lower spending regions. So we need to sit down and take a look and see why some regions are more expensive than if the overall outcome is not better than the ones that are spending less on healthcare. The CBO also states another factor in rising healthcare cost is the declining portion of out-of-pocket expenses. Um, Out-of-pocket expenses payments accounted for 33% of all personal expenditures in 1975. 2005, it was only 15%, and by 2015, this is expected to be only 13%. Consumers facing a lower out-of-pocket cost tend to demand more healthcare services than higher out-of-pocket cost. I personally don't want my out-of-pocket expense to be higher, but um, there are many people that I take care of that have a much lower out-of-pocket cost than I have, and I know that my higher out-of-pocket cost is a deterrent for me and many of my coworkers to go ahead and go to the doctor or to have to check into the ER and be seen because we don't want to pay that high deductible. Lastly, the physician shortage also creates a financial strain. National average for physicians is 128 per 100,000 individuals. Texas has 72 physicians per 100,000 in metro areas, and in non-metro areas, that's 52 per 100,000. Rural areas are hit hardest as many individuals in rural communities are usually lower income and do not have health care coverage. Preventive care was discussed earlier by many other state representatives, and starting that in rural areas would be a big way to go ahead and save on the financial strain that may come later on by taking care of these individuals that are not getting any health care access at all due to having more severe diagnoses and illnesses that could have been treated earlier on. The USDA stated that the non-metro poverty is highest in the South. In 2012, the non-metro poverty rate was 22.1%. An estimated 43.1% of individuals live in a non-metro region in the South. APNs can play a big role here by treating patients and staying and working in a clinic in a rural area to provide greater access to these patients and helping to find cheaper alternatives for healthcare for these individuals. 3 things I will utilize in my future practice that I have learned in this class. 1, the history of APNs and the increase in their scope of practice they have gained. Some states, obviously more than others, have more restraints. I will use this knowledge to work with state representatives to help increase the current scope of practice for APNs. Second, I've learned the difference between legislation and regulation. I plan to use this knowledge to better advocate for the needs of my patients, as I now have a better understanding of how the political process works. Lastly, I have learned the importance of continuity of care and the role APNs can play in reducing overall healthcare costs. I will utilize this in my future practice by finding alternative means to quality, affordable care. Thanks for watching my video, and I hope everyone enjoys their short break before we start back up.